Hi everyone, my name is Don. I'm 22 years old, and today I'm going to be showing you what a typical day on a surgical service is like as a junior resident. I usually wake up around 5 to 5:30 in the morning. I shower, I make breakfast and lunch if I can. I leave around 6 to get to the hospital about 30 minutes before morning rounds. Some busier services can actually round at as early as 5 in the morning. So I usually wear a simple dress shirt and pants to go to the hospital, even though I'm gonna change into scrubs as soon as I get there. I personally don't like wearing scrubs outside of the hospital, even if it's more convenient. Also, it really doesn't take much time to change. In fact, it can be as fast as this. And there you have it. I have this little bag that I'm not sure I like carrying around all day yet, but it does help me stay a little bit more organized with all my stuff. As a junior, when I get on the ward, I print the patient list, I record the latest vitals, labs, drain outputs, and this gives us a general idea of how the patient is before even seeing them. Then we go see every patient in the room, write a quick note about how they're doing, update the family and the patient about the plan for the day. After rounds, we sometimes have the time to go get a cup of coffee. Senior residents are gonna head to the operating room, and junior residents go back to the ward to help out over there, as well as sometimes I can go help out in a clinic. A lot of stuff on the ward is talking to other people who are also taking care of our patients to get updates. Examples include calling radiology to order a scan or a specific kind of drain that needs image guidance. We can also consult other medical specialties such as infectious disease for antibiotics or cardiology to optimize heart medication. There's also all the non-medical health professionals such as physiotherapy, occupational therapy, social work, which really help us get the patient better and also get the patient home. During the day, family members come and visit patients, and we spend quite a bit of time updating them, answering any questions, and obtaining consent for procedures if the patient is unable to do so. We can do some minor hands-on things on the ward, and that day, I simply had to change a Foley catheter, which drains someone's urine. So I went down to the equipment room to get a special catheter, enjoyed the view and got a few seconds of sunlight, walked back to the ward, and changed the Foley, which took me about 5 minutes. Depending on the day, I have time for a quick lunch. I like to bring things that are easy to carry and also easy to throw away. I don't like having lunches that have to be reheated because I have to look for a microwave. As well, I have to bring back the Tupperware to my bag, and if I'm somewhere else in the hospital, that's just an extra step and a detour. Sometimes during the day, we'll get consults from other services in the hospital or from the emergency room for things that might be under our surgical specialty. So I start by going to see the patient and evaluating how exactly we can help. I'll review with my senior resident to know what exactly we can recommend and if my treatment plan is correct. And then we will write our recommendations in the chart or give the phone call to the service that the patient is admitted under so that they can carry that out. We'll follow the patient until the issue is resolved from our side. When senior residents finish in the operating room for the day, they'll join us on the ward and we'll update them about what happened during the day and also round on the patients again. At this time, we're again gonna follow up on all the blood work, labs, and imaging results that might have happened, as well as read the notes from other services that they might have left in patients' charts. So that evening I was on call. So at about 5 p.m., my colleagues went home, and then I had the pager for the night. I went to grab a quick bite to eat at the cafeteria, and I got some sandwiches there. They have chicken fingers and fries and other better food, but it's a little bit of a wait. Because nothing was going on specifically at that time, I went to the call room just to rest a little. So I went to one of the call rooms, which has a desk, a phone, and a single bed, that I would rate like a 4 on 10 for comfort, and sheets are like a 2 out of 10. So usually when we're on call, we get paged for nursing issues or ER consults. Or sometimes there's just nothing. And that day was definitely a slower day. Nothing was going on, so I laid down and watched some YouTube videos. I decided to nap just a little in case things get busy that night and that I don't sleep at all. So I woke up around 9 p.m. and then I made sure that there was nothing going on the ward. I followed up with a few results that we wanted to look at, and then at around 10, I went home. I'm on Urology, which is home call, and that's because we cover 3 hospitals in the city, and also it's rare to have these pressing emergencies that we need to intervene right away. but they can usually wait a few minutes by the time we get to the hospital. If one of the patients on our ward is not doing well, we definitely are notified and we come in. However, if it's a very critical event, there's specialized teams in the hospital that can respond to that as soon as possible. That night, I got a few calls from the ER, more of questions than formal consults. I review with my senior resident and we give recommendations to the doctor, and I actually didn't have to end up going to see the patient in the hospital because they were well enough to go home. The doctor had more of a question that in case we wanted to do something. So as a resident, I have access to the electronic medical records at home, which means that I can, just like in the hospital, I can look up labs, imaging, and anything about my patients without leaving. If we need to order anything or give some patients some medications, then we'll just call in their nursing staff and give a verbal order. So I went to bed around 1 when I felt like things were quiet enough. And then at 3, I got woken up by the emergency physician again with another question rather than a consult. And again, I didn't have to go see this patient after reviewing with my resident because it wasn't something that needed to necessarily be seen in hospital, and the patient was going to be seen in one of our clinics. I fell back asleep at around 4 and I woke up around 5:30 to go and round again. So even though I didn't have a million consults in the emergency room and I didn't spend the entire night in the hospital, I did want to show what it's like to be on call when it's not these big issues, but rather a few small things and a few phone calls that we have to deal with. I want to thank you guys so much for watching. I really hope that this was interesting and provided some insight into what I do on a day-to-day as a resident. If you like this video, please leave a thumbs up, and I'll try to make other videos like this, especially on different services, just so you can see how they change. I'll see you guys in the next one.